Hello, we have an interview with Dr. Matt Brown, the Corrective PT in Arizona. He is a sports certified specialist and works with the former athlete as a moderator. Hello.
Hello.
How's it going?
It's good. How are you doing?
Good. Not used to seeing you on a Tuesday.
I know. I was like, man, I'm going to see her 2 days in a row.
Yeah. Make it up for last week. So I'm going to let you tell your story. We're going to go through some of the questions that I gave you ahead of time. So no surprises, although I can't promise. I may ask you one question that wasn't on the list.
That's okay. Throw me a
Yeah.
curveball.
But I'll start out light so you can kind of share why you started your own business.
Yeah. So like most PTs, I feel like we get into the business because we want to help people, right? So I feel like so I always knew I wanted to go into my own business. I wanted to do my own thing. I have this really deep drive to have purpose, and I feel like my purpose was to develop my own thing. And once I got into the PT realm, it was more trying to find how I could get the best quality of care and really help the people that I wanted to help and that I was good at helping. And with our current healthcare system, I feel like it was just wearing me out, seeing 20 people a day.
A little
And so,
different than the volume you do now.
yeah. So definitely a lot different than the volume I do now. So it just felt like you could give good care. It's just, you didn't get to spend the time that you wanted with them. And you wanted to give them the best care possible. And that's what we spent all these years of school doing, is to learn how to really help these people. And when I only get to spend 15 minutes with them and that's it feels like I'm just doing a disservice. So, I was trying to find something and basically build my own thing so I could do it how I wanted to do it and how I felt like people wanted to be treated when they see a physical therapist.
I'm going to ask you to step back a bit and talk about your backgrounds. After PT school, where did you work? What additional coursework, certifications?
Yeah, so I went right out of PT school. I did a summer of home health, but I went right into a sports residency after that. So I did 15 months in a sports residency in Tucson, Arizona, with a place called Body Central Physical Therapy, and worked 70, 80-hour weeks, both in the clinic, on the field, learning how to treat athletes, the steps that it takes to get them back to their sport. During that time, I don't know how many courses I took. I had like 300 CEU credits in like a year. And so I took all kinds of different certifications, dry needling, different return to sports stuff, shoulder injury, return to throwing, BFR, blood flow restriction, all kinds of different certifications to whatever I could to get me more tools to help these people, these specific types of people.
Yeah.
And then after the 15 months, I went straight into, actually before my 15 months was over, I went straight into being a manager of one of their clinics. Mm-hmm. And so I was a manager for them until I left there to open my own business.
Yeah. I wanted you to come back and highlight the intensity of the first 2 years coming out of school before you went out on your own, because I think there's, about our 10,000 hours in order to become proficient, and I think that's usually 5 years if someone's working 40-hour work weeks. And I think we have a similar background of we kind of condensed that 5 years into two by working multiple jobs or taking courses on the weekends and any second that you can absorb. And I think it's really important that you didn't fast forward anything. You still got the technical background, the mentorship, all of the training before just going independent and working in a studio by yourself.
Yeah, and that was the main thing that I wanted to do, was I wanted to be proficient in my skills, because I knew that then I was going to have to learn all about business. And so I didn't want to have to do both learning all at the same time and not feel like I was good at my job and then have to learn how to be good at my job and also grow a business. So I wanted, and that's what they say, residency puts you 5 years ahead is kind of the general rule of thumb. So my thought was, why don't I just do it all now, learn as much as I can, and then I get to use that and apply it, and I'll be so much further ahead with those skills, so then I can focus on the other things that I want to learn and want to do.
So what was the transition like going from manager of a clinic to going out on your own? Are you in the same neighborhood that you worked before? Did you take any clients with you? What was that like?
So I am not in the same neighborhood. I'm probably 25 minutes south or north of where I was. So close, but not super close to where I was. I had a couple clients follow me, just ones that I've did like maintenance stuff for. I think it was only 2 clients that ended up coming over with me afterwards. The transition was definitely hard, because going from a in-network to an out-of-network cash pay model was completely different. And you have to have a lot of confidence in what you're doing. And even then, you still doubt yourself a lot. So it was something that I knew that was going to happen, but you don't know the wave of emotions that will come with it until you're actually there. You can kind of speculate, but until you're going through it, you don't really know. And then the same with like the amount of time invested and how much work actually goes into it. You know, everyone talks about how much work it is, but like until you're actually doing it, you don't realize how much stuff there is to do all the time.
Yeah.
So I think those two are the biggest transitions, is just, you know, having to learn everything else besides my skill, what I set out to do for my career. Now I'm learning everything else.
Yeah.
And going away from learning my skills I'm trying to actually bring that back this year, focus some more time to build my skill set, because taking a year off of it just feels like, I don't know, it just feels wrong.
Yeah. We've been working together since November.
Yeah.
So not a full year of strictly business learning just yet.
No, but I feel like all year and a half that I've been in business has all been geared towards learning how to do business. Yeah. So it's I'm trying to navigate the learning both. Balance both of those things.
Yeah. One thing that a lot of people ask when they're kind of thinking about going out on their own is the cushion. So there's a couple different ways that you can go about it, either having your own savings and, you know, paying yourself during that time, or getting a part-time job. So kind of talk about, what did you do for security financially? It's not just you that you're taking care of, right?
Yeah, so. I got a family. So I worked 2 jobs leading up to opening my own business. So I worked a full-time job and then a part-time supplemental PT job. And all the money I made from the supplemental job was basically funneled to open this business. I didn't really save any money coming into this. I spent all my money to invest in building it. And then as soon as I got here, I quit my full-time job, and then I kept my supplemental job. So I basically figured out how much I could live off of, how much I needed to bring in. So then I worked my supplemental job as much as I could to make that money. And then all the rest of my time was spent at the business. So that's how I navigated the cushion. It was, it wasn't easy because I also got married last year. And so we had all that financial stress. So
yeah, that was a fun surprise. You told me like a month into working together, oh, by the way, I'm going to be out next week for my honeymoon. You're planning a wedding at the same time? What?
Yeah, so last year was just crazy, and so that made me more scared to leave that job because I just had a lot of obligations. And then this year, once I got past all those obligations, then it made it an easier choice, but I was also at a time where it just needed to happen. At some point you have to take the plunge.
Was it a year?
Yeah, it was, yeah.
It was a year, right?
Yeah, 1 year, almost to the day.
And what made you feel confident that that was time to be able to rely on the business instead of rely on a supplementary paycheck?
Well, the things were moving in a positive direction for 2 months. Well, really, actually, it was just that first month because December was so crazy. January, I mean, we had had a really good January, and I was tired of it. I think it wasn't more that I felt like I had the cushion because we were planning when we were talking about it to do in March. And then I was like, no, I'm just going to be done, and I'm just going to basically sink or swim at this point, and I'm just going to go. Because it was hard for me to try to be that invested, but still have this other thing that I had to think about all the time. So I felt like I was doing a disservice to the business at that point because I was busy enough that it now was taking time away from that for me to grow it. So I was like just enough money that I could survive probably, and then hope that it just grows.
Yeah.
And so it was more of a plunge than it was like I was completely sure. But for me, I feel like it's never I'm completely sure this is going to happen. I'm going to make it happen. I'm going to try my best.
Yes. Well, you have a lot of confidence to bet on yourself. Betting on yourself, you're going to show up. I think something else from my perspective, going through that time period with you, being able to see future visits on the schedule, being able to see some leads coming in and knowing that there's predictability for February and March, kind of being able to look ahead.
Yeah.
That's something that we've focused on a lot.
Yeah, I would agree. That was basically making sure people were scheduling out and all that. It made it look a lot more solidified that there was business coming and you could actually see it.
Yeah. Give me your big lessons from year one. So you opened January of 2023. So kind of that first year push, what was?
Well, I think my biggest lesson is that, you need to find a business coach to help you. Yeah.
Thank you. He was not paid for that plug.
A nice little shout out. I think that's been, for me, that's probably been the biggest thing is because knowing my weaknesses and limitations, needing someone to help me with other parts and keep me in a positive direction and learning where to go has been a huge help. Just learning from someone that's already done it.
So I think I met you in April. We talked a little bit on Instagram, and then we didn't start working together till November. So I think there was some trial and error in the beginning, which I think is a good thing, right? You have to have some context of, hey, I think this is a good idea, and then you try it and you're like, I don't know if this is a good idea.
Yeah.
So there was a little bit of trial and error kind of in those first 6 months or so.
Yeah, and I always like to say, sometimes I wish I would do things earlier, but really I needed those 6 to 8 months to know that I could do it and find some success in what I'm doing, and then have someone help me with that.
Yeah.
Instead of feeling like all the success is other places, like other people are doing it. Although it's not that way, it just, for me personally, that's how I was kind of feeling. And I wanted to know that I could, get clients in and have them trust me and believe in me and know that it was coming from me and that I could do it. So I needed time to kind of do my own trial and error and fail in certain ways so that I knew that I needed help, where I needed help, and what I needed to do.
Yeah. And just to clarify and, give you a lot of credit, I think that you set a really strong foundation. The only areas that you were kind of not going in a direct line and kind of testing in a lateral direction was like, should I do ads? Should I try this? Should I pay this person to help with SEO? And it's like, when you're not sure which thing to do, those are very expensive things to play with versus,
Agreed.
I teach the organic foundations first. And then if you want to try ads, okay, we know we have the lead tracker in place. We have some things in place where you're like, okay, this is a tested experiment and I'm only spending this amount of money on it.
Yeah. Yeah. And then you test and make sure that it actually works before you spend lots of money there. Yeah. Agreed.
Any other big lessons that you kind of have to just learn from doing that maybe somebody else told you about with more experience and then you're like, I didn't realize it was going to be like this?
Yeah, I think the other big thing is you just have to really open up your mind on and be vulnerable to what you're good at and what you're not good at, and know that you have to work on things. I think that was another big lesson for me that I've spent a lot of time this year is working on myself to better prepare me to be a good business person. Just, being able to manage relationships better, how you talk to people, how you do things for other people and how you word it and how, just little things that can go a long ways, and to make sure people know that you're genuine. I feel like that's a big thing that people don't really talk a lot about. They say that people talk about, self-improvement and all that stuff, but I feel like for business, you really have to dive into that, because if you don't have those skill sets in your normal day-to-day life, you're not going to just have them. They're not going to just magically appear. So I feel like that was another big thing this year. That and it's going to take time, and it's going to take a lot of consistent effort, and you have to be okay riding that roller coaster of emotions and ride them out. Because there's definitely times that it feels like you're not good at what you're doing, even though you know that you are. Because now that I'm in business, right, people come to see me. If they don't come to see me, it automatically feels like a failure, like I'm not good enough. But it's not. It's not always. That's not really what it is. I'm sure sometimes it could be. If you're not actually good at things, but
right. But you hit on a couple things here. So one thing is dealing with the first call when you are out of network or cash based, and being able to release I'm going to have people say no to the price, and it's okay. And I think something that we worked on in the beginning, and you're really good at being fully vulnerable and saying, like, this is what it is, give me the feedback, I don't care if it's good or bad. I have been tough on you, but
hey, that's what I asked for.
Right, understanding, like, I think a big struggle is, and I deal with this even with my own front desk team, of when you answer the phone, you're not convincing someone to come here. You're not convincing someone that you're the best. If they want to go use their insurance, then we have those referrals in our pocket to say, here are the closest in-network PTs, go ahead, give it a try. If you need anything else, come back, right? And that takes a lot of confidence in being able to say no, especially when your schedule is not full and you're like, but I need the money, right?
Yeah, I think
Now you're
that's
in
the
a place
hardest
where your
part.
schedule is full, so it's a lot easier.
Yeah, now it's definitely a lot easier of a change once your schedule's full.
Yeah. But in the beginning, knowing that it's okay if people say no, it's not a direct insult to me. And then also now you've built up, I think you have like 45 or 50 five-star reviews. So you're also getting that positive feedback from the patients that see you. You're able to read those reviews and say, yeah, like this is their perspective.
Yeah.
It's not just me who's seeing that their range of motion got better or whatever it is.
Yeah, agreed.
Yeah.
But it's definitely a big thing to learn.
Yeah.
Well, still learning, but
And
still.
that's with everyone who believes that they have a good service, like they want, like, I know I can help you. So there's a little bit of like the other thing that you touched on that I think is a really important point to bring up, because not too many people talk about it, is that self-care piece and working on yourself. And like, what does that actually mean? Well, like you and I went through this in, I think it was March or April, of like, okay, I'm not willing to take anything off my schedule.
Yeah.
But I know that if I keep operating at this level, I'm going to hit a point of burnout. And I can't hire until the fall, right? Our timeline is the fall to get somebody in there.
Summer,
So
fall.
what can I do to keep operating at this level, both at work and at home? And, you know, we went through some of these different techniques, and what works in one stage of business doesn't always work in the other. Like in the beginning, I needed the tough love, cold showers. Like those are things that we're talking about, like 5 a.m. workouts. Now at this stage, I need the like yoga and meditation and calming, regulating things. Like a 5 a.m. podcast yelling at me doesn't work the same way.
Yeah, it hits differently at
Yeah.
different stages.
Yeah. So I know you've kind of implemented that over the last month. So maybe you could talk about some of the things that you found that have been helpful.
Yeah, I mean, yeah, we talked about that a bunch because I had a crazy April, and I knew that it was going to be crazy, and business has been growing every single month, so it was busier and busier while my personal life was getting busier. Yeah, so, well, some of it I just couldn't avoid. It was just going to happen regardless, because we had to move. We bought a new house. We had to move. We had to sell a home and then sell my other home. So you can't avoid those things. But the biggest thing for me was finding a work-life balance of, I know that there's always stuff to do for the business, and I could do it all day, every day. But when I go home, I'm leaving it at the clinic, and I'm not going to take it home. And I haven't been doing that the last month and a half. Just focusing on, when I go home, it's time to turn off. And then the next morning when I wake up and I get things going, then I can start re-implementing what I'm trying to do for the business. But every night when I go home, that's when I'm just shutting it off, unless clients reach out to me. But other than that, all the other,
there's always a couple of exceptions.
Yeah, the exception is clients, because I'm always trying to take care of them. But even then, I'm still picking and choosing when I'm going to do that, because I have to have some time off of thinking about it all the time. It's not even if I'm doing it, it's thinking about it too. Is just, it wears on you. Yeah. And then I'm not fully present in the other things, in my family life. And so that's been a big thing I've tried to implement, as well as just my workout regimen. And as I got busier, I couldn't do it at the clinic anymore. So build the garage gym so I can get it when either the girls are sleeping at home in the morning or at night. Now I don't have an excuse to not do it. So I think that's been the other big thing that I've implemented. And then reading. Although I am reading self-improvement books, it's still something that helps kind of wind me down. That feels productive.
Yeah. Those
have been, and then I have done the cold showers. I did implement that.
Listen, it's helpful when you're just operating at that on all the time.
Yeah.
Right.
Yeah, and so
Once,
those are the big things that I've implemented so far. I think the biggest thing was just turning off,
yeah,
working on the business and thinking about the business at all times.
yeah. I think that that is a really big one, and it feels counterintuitive because it feels like, oh, I just need to keep going and then I'll have less for tomorrow. But at a certain point, it's just not effective, right? You're operating at such a slower pace and, right, you're drained. So having that hard shift, and that's important. Like I always talk about, all the owners in our membership are doing this to support their families and be able to have time off with their families. Well, if you are, in order to get there, if you're not seeing your family for 2 years, then it's kind of like, wait,
Is
what
that
happened
what
here?
you wanted?
Yeah, yeah.
Yeah,
Um,
agreed.
all right. The story that I was going to ask you to tell is about direct access. So this is something I talk about a lot. Is I feel like PTs get direct access marketing wrong. Everybody talks about direct access to a physical therapist as being the most cost effective and the most convenient, and I don't believe that that is true. And I think you have a personal patient story that proves that the real reason for direct access is because a PT is skilled in differential diagnosis and can refer to the right person. So I'd love for you to share that.
Yeah, actually, I just had lunch with him today.
Oh, that's awesome.
Yeah, he came back. But yeah,
Great.
so it was kind of a crazy story, but yeah, back in, what was it, February, I think it was. A guy called me and he wanted to get in for an evaluation that day. He was leaving to go back home in 2 days, and told me that he had right leg pain, and previously was told that it was sciatica earlier that week by a different healthcare professional. And so he came in, and 5 minutes into the eval, I was like, you gotta go to the emergency room, man. You have something that I don't know for sure what's going on, but my back.
You have us hanging at the best part. No, go ahead.
Sorry. So I told him I found some things that his whole right leg wasn't working. And so he was told it was sciatica, and he kept asking me about that, and I was like, if you had sciatica, it's very pinpoint. There's direct things that it affects. It doesn't affect the whole leg. And there was other things that he told me that if I didn't ask a bunch of probing questions, he would have not even thought of. Like I asked him, was there anything else impacted that he's struggling to do? And he was like, yeah, I can't type. And he's like having a hard time entering his data into for work. And so his right arm wasn't working that well either. He might have had some cognition stuff. And so I was like, I probed into his history. He was traveling a bunch. My thought was he had a clot. Turned out I was wrong, but close enough. He had a brain bleed. I'm not sure if it was trauma related. He didn't have anything crazy trauma induced, but it could have just been a random brain bleed. So I sent him to the Mayo Clinic here. Instantly they found a huge bleed in there. And if he would have gone on his flight back home in 2 days, he probably wouldn't have made it. So he got everything worked out well. His surgery went well. He's healing now. He talks to me like once a month. When he's in town, he comes and takes me to lunch. He's actually planning to move here. But yeah, so I mean, direct access, I feel like for us is we spend so much time learning about the human body, the physiology of the musculoskeletal system. Most other professions, right, that's not their base skill set. That's not where they spend all their time. So they're equipped to do these other things, but they're not equipped to handle what we look at on a daily basis. That's what all we do. And so if we know if it's coming from the musculoskeletal system or not. And so I feel like the real reason we should have direct access and why we should be the lead providers for a musculoskeletal system is because that's what we do. That's what we see. We know if it's coming from there, and we can make the right choice of where to send them if it's not coming from there. And I feel like, yeah, I mean, you can always talk about cost effective, and I feel like that's here or there on whether or not that's an actual case. The true matter is that you're taking care of clients, and I think the best way to take care of clients is if we're specialized in musculoskeletal system, that's why we should be direct access for musculoskeletal problems or what we think might be musculoskeletal problems.
Right. Thank you for going into detail and sharing the story. I think that the biggest takeaway, it's not that you made the correct diagnosis, it's that you were able to rule out, right? I mean, that's
I just like to throw that out there.
Yeah, because it's not a story of like heroicism where like you knew exactly what it was and you implemented some technique in time. Like that's not what this is about. It's about recognizing that, hey, this isn't sciatica, this isn't presenting like a typical musculoskeletal problem. You need to go to the emergency room, and being that person to push them, where if this man was on vacation and he may not have took it as serious, oh, I'll just wait until I get home, right? You were able to triage and let him know the correct place to go versus treating the sciatica presentation and kind of just going about what was given to you.
Yeah, and actually deductively reasoning what was actually happening, not just going off of what was said.
Yeah.
Agreed.
Anything else that you want to share on this account? There's mostly student PTs and PTs who are thinking about going out on your own. So anything that you want to kind of end with?
Yeah, I mean, obviously, small business owner and entrepreneurships, it's not for everybody, but so I feel like the biggest thing is knowing what you want and what you want to do and how hard you're going to be willing to work for it. You can make it happen. It's just whether or not you want, how much you want to make it happen. For me, my wife was asking me, how long would you give it before, like when you started this, if it doesn't work, like how long would you give it? And I said, well, I'm not going backwards. So that was my response. That was just that's how I am. It's like once I decide to do something, that's what I'm going to do it. I'm going to find a way to do it. And it might not be the exact thing I envisioned, but it's going to be what I want to do, and I'll pivot. But I think that's the biggest key is you just have to know that you want it. And then you have to be willing to work at it and long enough at it to make it happen. And I knew that going in, and I was going to spend whatever time I needed. Obviously, I have things that I won't sacrifice, but there's lots of things that I will sacrifice in order to make this happen. And I just set boundaries on what it is that I won't sacrifice.
Right. And now that you're at the 1.5 year mark, you can start implementing some healthy habits again.
Yeah.
Little by little.
You got to grind. You got to grind some, So
by the 2-year mark, you're going to have a team, right? We're set to hire for the fall, and then once you have a team with you, it's not everything coming on you. Right now, you're wearing all the hats, right? Soon you'll be able to spread that out and bring in people who see the same vision as you, who want to work with former athletes who have the same passion and understand why we're doing this.
Yep. Agreed.
Well, I'm really excited to continue to see where your practice goes. And I appreciate you coming on here and sharing the story, because I think it's really important for people to see what's possible and know that there's more than just replicating the job that they came from, or, right? How big is your office?
700 square feet.
And we got a squat rack, we got a treadmill, we got one table. All you need.
Yep. Definitely plenty of stuff in here, even though it's a small space. But yeah.
All right.
Thank you so much for having me on here.
Of course.
I appreciate it.
I'll see you tomorrow.
All right.
All
Bye.
right. Bye.